Chris.
Hey, thanks, Sam. Hey, Greg. Have
Hey.
someone new and just trying
Uh-huh.
to get some clue before I see them in a week or so. 61-year-old female is wondering if you can tune in. There's some
Okay.
weakness on the
Okay.
some weakness on the left side, but she's
The whole
indicated
left side or just like part of her left side?
she just said left side weakness. And then on the pain level, she indicated 7. I've not seen this person yet. It seems like she's had various surgeries due to physical injury.
Okay. And do we know the nature of the injury or no?
No.
Okay.
She's also trying to read here. Progesterone, maybe, is what this is.
Okay. Yeah.
Yeah.
Even our age, that's pretty straightforward.
Oh, okay.
Yeah. Okay. Well, whenever you see a 7, like without even knowing that the nature of the injury, that's usually some sort of nerve pain. Like that very rarely is like nociceptive pain, which is dull, achy pain. Rarely is it like a 6 or a 7. It's like a 3 or 4, a 2, and it's just nagging. Like you don't get a break from it. When you start seeing sharper pains like this, it's either a herniated disc, an entrapment, an impingement, a spinal injury, can be scoliosis, bone on bone, and it could be the spine, it could be the hip, and so, and then you can also rule out that there's the like a migraine syndrome sometimes, but if you really look at like sharp pains, of course it could be in the gut, of course it could be other things, but without having a lot of information, you can start going through soft tissue issues pretty quickly. And so even if it's in the gut, several things that you want to go through and address, right? And so of course you can do a little bit of general cleanup, you want to check out her stress levels, all the things to do. You go through, you do your little evaluation, you ask them the questions and look for anything that is a potential aggravator in their lives. It's not necessarily a cause, but you just look for the aggravators. Okay. And so it sounds like you're even doing that before you even see them with the forms and stuff. So that's great. Yeah. That's actually quite helpful. I always just kind of did it on site. It would have been nicer to have it ahead of time. But so a couple of things. Regardless of what she presents with, when you have like pain is at a 7, you want to go through and address, for one, there's going to be bronchial spasms, right? So the throat liner, using oils that are like the bronchioles blend, just even hyssop. Even from the class this weekend, the uvula.
Oh yeah.
Yeah. That one's not quite for bronchial spasms, but it is also, it's like hitting the respiratory tract, but soothing the limbic system. It could kind of come into play here. Like, you could actually even explore that. So, do healing on the bronchioles and the upper part of the lungs, and then, the oils to deepen the breath right there. That starts to do a couple of things. Right there, that starts to diminish the strength of the sensory stimuli going to the brain that's carrying the pain information, right? So you're going to diminish that. So you're already starting to take them out of that 7 and drop them down. And also, when you start to unwind the bronchioles, you are starting to take tension out of the spine and the spinal muscles, the little multifidi that kind of go up and down the spine. They like kind of crisscross and stuff, that allow for like rotation of the spine and things. And as soon as you start to take tension out of that, you're starting to take pressure off the spinal nerve. And in all of that, you're also wanting to clean the diaphragm, clean and energize. So the unwinding of the bronchioles will also hit the diaphragm, which then has a cascading effect then on the spinal muscles. And so going through doing that, cleaning up the front, but especially the back solar plexus, lower emotions, stress, so you could use Gilead, you could use marjoram, you could use anything that's just going to reduce some stress and some agitation in the body. Gilead was originally made for dealing with the emotions that come from being in pain. And, we use it for a lot of other things, but that's what it's there for.
Emotions being in what? Sorry.
Gilead. Being in pain.
Oh, in pain. Okay.
Yeah. Got it. And so, and then don't forget about galbanum, be it internal. And, if galbanum's a little bit of an odd smell for the person, you remember that blend threshold.
Yes.
It's for the same kind of thing that galbanum does. There's a couple of different ways. Myrrh could potentially do it. Myrrh does it in a little bit different way. Myrrh is hitting receptors in the brain. I usually go galbanum, but if they don't like it or they don't want to take it internally, try one of the alternatives. And then whatever they've got going on, then just go through and address, what it is. And so you can use something that's kind of antispasmodic. One that we kind of forget about is the Spasmophilia blend. It's very good for opening up health rays and things like that. So getting energy to move in the particular area. Plus, it's antispasmodic, especially when there's like splinting of the joints, which happens when something's been compromised. And then the pain relief neuropathic, just put it directly on the site, and that should be helpful. Healing wise, you can always open up the joints. And with this person, there needs to be a lot of cleanup on the basic chakra.
Basic. So basic and solar. Is there a particular protocol you think, or just touch on those?
I would say, like, are you talking about with pH or with pH? I would probably look at, let her present with what it is, but you're probably going to end up doing some version of the herniated disc protocol.
Okay.
Yeah, it works really good for that. And the big piece of that is shrinking that back solar plexus. Like if you shrink it, because just think of it like this, the back solar plexus is all about the body tension. And so if you can calm that down, if you can shrink that and calm that down, the tension will leave the body. There'll still be some tension there, but it will greatly diminish. Part of it is tied to the bronchioles and the diaphragm, and some of it is just that emotional component. So those things that I talked about with the oils will take you down that route. And then with the healing, like just green, blue, violet, just really emphasize on blue, like several minutes of blue.
Got it.
Yeah.
So Greg,